We are at the edge of a revolution in our profession because when you see two things happening, one, unbelievable factors that are so obvious that is impossible to deny, and almost nobody doing anything about it. Think about this. And 3, 2, 1, and we are back with Coffee Break with Coachman, where I bring the most brilliant minds that I know in dentistry to share their thoughts with you, insights to help us succeed even more in this beautiful profession. Today, we are back to my preferred topic in dentistry at the moment, the oral systemic link, and I'm going to bring a new friend that I'm completely impressed by everything that he's been developing. His name is Dr. Arash Hakhamian, and he is a master on the financial world of dentistry, investing in startups, and most of them related to the oral systemic link, how to become an oral physician, and own a strong space on this revolution that is about to happen in dentistry. I hope you enjoy. Welcome back. Thanks for connecting. We already have some people in the room here, and I want to introduce you to my partner in this podcast, Kirk Barrett. I don't know if you ever met him or have you ever heard about him.
Yeah, I haven't had the pleasure of meeting you, but I've seen your face. So yeah, it's nice to meet you.
Well, nice to meet you. I'm excited to learn more about you today.
Thank you. Yeah, it'll be
Yep.
fun. Where are you located, Kirk?
I'm in Milwaukee, Wisconsin.
Oh,
So,
nice. Okay. I was
yeah.
just there actually. I was there
Really?
at is it called Summerfest?
Yeah, you didn't call? It's like 1 block from here.
I was there. Yeah, I was there with Protect. I'm one of the KOLs for Protect, and Apex Vista is based out of Milwaukee.
Yeah,
So we went to Summerfest. It was fun. It was really
yeah.
nice.
Fantastic. So, Arash, I was trying to explain to Kirk, who are you, professionally speaking? I tried my best to explain, but it would be better for you to give us a little overview of your amazing career that brought you all the way to this point where you became an investor and a supporter of startup projects in dental tech. And we're going to talk about the technologies that you are supporting, investing, helping develop. But give us a little bit of a background.
Yeah, sure. I come from a family of dentists. My father was a dentist, and he worked with the Shah of Iran when the revolution occurred, came here. He ended up going through all the board certifications all over again to regain his license. And so I basically grew up in a dental office. My mom, dad, brother, sister, everyone's in dentistry in some capacity. I went to UCLA for my undergrad, studied anthropology, and then went to USC for dental school. Studied under, great dentists like Monnier and Phillips and Kahn. Graduated dental school and opened up immediately, went into office ownership. Didn't really do any kind of associate work. I just kind of took a leap and started an office, and that ended up turning into 2, 3, 4, 5, 6, 7 offices, and ran several associate run practices, which really gave me the opportunity to step away from, the being directly involved in the day-to-day clinical care. And I was then going out and doing a lot of volunteer work remotely. I was doing a lot of telemedicine and mobile dentistry, and got involved in doing a lot of implants and work with Dr. Jin Kim and a couple of other periodontists and setting up an organization called the Global Dental Implant Academy, training dentists how to do implants. So I did that for about 10 years, and really had a great fun time doing dentistry, and was able to step out of the chair. So I started getting involved in the technology um, a couple of years prior to the pandemic. Decided to open up a mobile dentistry company and partnered with Google. And that's how I learned about the other side of dentistry is, pitching and, and creating investor decks. And I raised money for my own company. And through that process, ended up working with a bunch of other startups. And I was like, what if these guys can invest in me? Why shouldn't I be investing in other companies? And working with other like-minded entrepreneurs, and just started investing in other companies, and I started advising several of these. Really, the pandemic changed our focus from mobile dentistry to teledentistry, and that's when really I had an opportunity to meet a lot of innovative companies and incorporate them into our platform. So now I serve as a fractional chief dental officer for a couple companies, and invest in quite a few companies, and help form SPVs, and help other dentists also get involved in not only advising but also in investing in some of these companies. So
Because of his background and because of his experience, I invited Arash to join us in Miami for the Kois Coachman Course. Arash is gonna be sharing the stage with us, sharing with us his story from two perspectives that I want to mention a little bit here, Arash. There's two things that really interest me in what you achieved. One is your career as an investor, meaning, as soon as you started to make money as a dentist, you were very successful on diversifying where you're putting your money, right? Dentists, as they make more money, they either save the money or they reinvest on their own practice, or they invest on average things that normal people, everybody invests on. I'm more and more very interested on learning from people that actually saw this genius idea of investing, not investing on the conventional market, but investing in the area that you know much more, that is dentistry, but not investing on your own practice. So not doing what everybody does, neither option A, neither option B. Option A, investing outside dentistry where you know nothing and you're relying on a bunch of factors that you don't control. Or B, investing on your own practice that is more of the same, putting all the risks back into your own hands, right? And then you have option C, that is actually diversifying, not investing on yourself, but investing on the market of dentistry, investing on dental companies, investing on things that you, as an insider, knows that has a chance of growing and multiplying your money. And this became, I would say, one of my main topics for the last few years, learning from many people on how to identify these opportunities and leverage my know-how as an insider, leverage my know-how as a clinician, as a technician, as a practice owner, as a lab owner. We get so much information that we don't get from outside companies, right? So that's one topic that I want to explore here. And in Miami, you're going to share your strategies there that I really want people to learn. How did you start? How do you identify the opportunities? How do you compare the opportunities? How do you choose your opportunities? And how do you help increase the chances of growing your money when you invest on these opportunities? So that is one part of the topic. The other part of the topic, and I was blown away when you started to mention what type of companies in dental that you were investing, and they were mainly completely related to the topic that I think is the hottest topic for the next 5 years in dentistry by far, that is this oral systemic link. How to provide care beyond the mouth, how to understand wellness as a whole, how to understand health as a whole, how to become an oral physician. And from your portfolio, I don't know if it's all of them, but most of the companies that you're investing are developing solutions to transform a dentist into an oral physician, right? And to put the dentist into this new position that for me is going to be the next revolution in our field. So I want to start from the second topic. I want you to give a little summary, like you did to me when we chatted, both of us, the last time. I want you to give a little summary of the coolest technologies that you are investing and that you are an advisor as well and are helping these companies to develop these solutions. Give us
Christian, I wish you were with me this last weekend in Las Vegas. I'm not sure if you're familiar with this organization. It was called A4M. It is basically, you've heard about it? Yeah,
Yeah.
it's a longevity,
You mentioned it to me. You tried to convince me to go. We actually
no.
talked about
That's
it.
CES. That's in a couple of weeks. That's CES.
Okay.
In Las Vegas as well. I just found out about this and I went there. I don't know if you know Peter Attia.
I'm reading his book. I'm finishing his book right
I
now.
was with him. I was with him this last weekend, and I
Fantastic.
was I don't know if you know the guy who started Bulletproof Coffee.
I heard about it. Yeah.
Yeah, eccentric guy. Like there
Yeah.
were some like heavy hitters. So I want to mention sleep a little bit if it's okay with you as well, because we're doing a lot in the sleep apnea space, but
Yeah.
I have a lot to share with you because I mean there's so much good stuff that we can add to this from an overall perspective. Like even the dentist now, in my opinion, should be checking the blood. We should be checking for A1C. We should be checking for metabolic and genomic markers. So I'll touch on that, but we can share a little bit more on that. I'd love to share more
Yeah.
privately with you. But yeah, we'll definitely discuss it. I think it's a great topic.
Just to let everybody know, Arash is going to be with us in Miami at the Kois Coachman Course, and since the course is all about how technology is impacting the outcomes of our treatments, I'm inviting Arash to bring the Dentistry 3.0 topic that is actually inspired by Peter Attia on Medicine 3.0 that he talks about, and we are 100% focused on Dentistry 3.0. And Dentistry 3.0 means using all the solutions that you're going to be bringing to us to Miami, and you're going to list them and give us the insights on how to deep dive into the ones that we think are the most interesting ones. So give us a summary of these solutions.
So look, it's no surprise that the mouth is connected to the rest of the body, and we see not only manifestations of systemic disease orally, we see manifestation of oral disease systemically. And so this is something that we've known. I'm sure we've all talked about this to our patients that, your oral health can affect other parts of your body. But really, I think where dentistry can bring itself up to speed is in checking for actual empirical data, looking at biomarkers, checking the saliva, checking the person's A1C values, and actually looking at this very similar to a patient that goes to their medical doctor and gets a
Yep.
blood test. We are experts in the saliva and the oral cavity, so we need to be looking at the oral microbiome. We need
Yep.
to look at the bacteria that we know are contributing to cavities and periodontal disease. And now, really, I think this is one of the most exciting times in
Yep.
dentistry.
100%.
I mean, this is it. This is our dentistry is no longer just about teeth. It's no longer just about your gums. It's not about whitening veneers and implants. It's about saving lives. It's about improving the quality of life. And dentists are now at the front line
Yep.
helping improve people's lives and increasing their longevity. So it's very exciting.
Yep.
And I think the tools that we need to start learning about have even been around for a while, but now really need to come and we need to educate ourselves on using these tools to be able to properly educate ourselves and our patients about what's going on in the oral microbiome and when it is in dysbiosis, when it's
Mm-hmm.
not functioning properly.
Yeah, 100%.
Yeah. I think
Go
this is
ahead.
super exciting. I have so many questions, but one of them is, I'll just tell you a quick story. I met Dr. Kenneth Cooper from the Cooper Clinic years ago. And when I met him, I told him I was in dentistry. And he said, dentistry, that's our future. He said, do you know that 70% of health problems are related to the hole under your nose? Would you agree with that statement? I mean, we're learning so much about what happens here. What percentage do you think of our health problems are related to this area below our nose?
You know, I would say that if you take into consideration sleep and oxygen, I'd probably say it's probably closer to 80 to 90%. I am just shocked at the amount of patients that are walking through my own clinics that were going under evaluated and underdiagnosed for sleep disorders and sleep apnea. Once I
Mm-hmm.
started actually evaluating my patients and asking about, their quality of sleep and looking at comorbidities, I was shocked to see probably 7 out of 10 patients were having sleep issues. And
Mm-hmm.
we're looking at bruxism and grinding and clenching and abfractions and are you stressed out? Are you over brushing in those areas? Really, what I've seen is that the majority of these patients are having sleep issues, obstructional, sleep apnea,
100%.
that translates into other issues. So if you look at sleep and oxygen, it is the fundamental backbone to any type of quality of life, right? Whether
Mm-hmm.
you want to lose weight, people are now saying, how are you sleeping, right? How, because your metabolism is directly impacted by the quality of sleep. You have
Yep.
diabetes, how are you sleeping? You have attention deficit disorder. What does the sleep look like? So a lot of it just goes back to sleep. So airways, just fundamental. We have to look at that. And then we've now been able to isolate gingipanes from P. gingivalis, which is an oral bacteria that has crossed the blood-brain barrier in about 96% of patients that have Alzheimer's dementia. In fact, it's now peer-reviewed articles looking at it as a causative factor. This is not correlation. This is causation as a contributing factor to Alzheimer's dementia. We now have physicians that seek our approval and clearance before they do heart surgery because we know that bacteria go straight into the bloodstream and can actually cause bacterial endocarditis. So the stuff is going into the bloodstream. One of
Mm-hmm.
the examples I give my patients to just make it very clear is I ask them about angina. I said, what happens when you get that chest pain, angina? We want to get that medication to the heart as quickly as possible. So do we inject it? Do we give you a pill? No, right? We give you nitroglycerin under your tongue. Why? Because that is the fastest way to get into the bloodstream. So if you think
That's a
about that,
great example. That's a
right? If you think
great
about
example.
imagine all the bacteria that's constantly leaking into your bloodstream.
Mm-hmm.
And I mean that if we can deliver medication sublingually, well, guess what? Bacteria is also going sublingually, and not only are we swallowing it and
Mm-hmm.
going into the gastrointestinal system, you're also inhaling it, and
Mm-hmm.
you're also just having things go directly into the circulatory system. So
Mm-hmm.
fertility, premature birth, multiple types of cancer, including prostate cancer. F nucleatum has been now really associated with higher risks of prostate cancer, for example. And then if you look at the success rates of chemotherapy, the success rate is impacted by the state of your oral health, right? So in order to have better success rates with certain types of chemotherapy, you have to have good oral health. So it's so intertwined
Yeah.
with other systemic issues that I think that dentists again need to focus not just on what the insurance covers. And yes, that right
Yeah.
now maybe the insurance carriers haven't caught up to what
Far.
really is going on, but as a profession, there's no more of a noble thing that we can
No,
do for our
I
patients than
think
improve
this
their
is
oral health.
so big, Arash. I think this is so big that we are at the edge of a revolution in our profession, because when you see two things happening, one, unbelievable factors that are so obvious that is impossible to deny, and almost nobody doing anything about it. Think about this. Like, we have this huge topic that, as we mentioned, any of the stories you mentioned, there's not one human being on earth that is like, holy cow, right? Boom, on one side. And then on the other side, you see dentistry in general doing almost nothing about it. And of course, this is not going to last long. And this is when you see something about to explode, right? And then on top of that, you put all the technologies and super ultra powerful smart people investing a lot on developing solutions to create this connection, right? And you have the foundation for the revolution to happen. It's just a matter of asking you, dentists, in what moment of history you want to join this, right? Do you want to be at the forefront? Do you want to wait and just follow after because the revolution is about to happen? We always repeat this. Dentists have everything in their hands to become a completely different professional in the next few years. Everything in their hands, because they have the definition of the importance of the oral environment with the systemic environment. And you said the shortcut to the brain, the shortcut to the heart is the mouth, right? We have the fact that we own this space, and we have the fact that patients are already coming to us much more than they go to physicians. They come to us much more than they go to physicians. They come to us once, twice a year without even knowing about this connection. Imagine when they get to know that we can be the gateway for all of this, right? And on top of that, you have the fact that dentists are doctors that were able to keep the relationship with patients. Medicine, I would say, in general, lost that relationship. It became a very mechanical thing. You don't even know the name of many of the physicians that you go anymore, right? The dentist you still know. You know who is your dentist, right? So I don't know if you agree with me, Arash, but I think that all these factors together are preparing the stage for this revolution to happen.
I want to give you like a reaction to what you just said. I disagree that we own this space. I think we loaned this space. I think ownership is not a right; it's a privilege. So I
That's
think
right. You need to conquer it.
yeah, dentists loaned this, like we've been loaned this space. What we do with it now is going to determine whether we maintain ownership out of it or not.
Yeah.
And I
We
think
have the first right of refusal. We have the
that's
first
right,
right
exactly.
of
We have the first right. So we've loaned this space, or this space has been loaned to us.
But if we
Now
do nothing, we're going to lose it.
we and believe me, we are at very high risk of losing it, because so I see dentists here on the left, I see physicians on the right, and I see both of them encroaching into others' spaces. So now you have dentists doing medical procedures like sleep apnea has traditionally been looked at as a medical issue. And in fact, we build the medical insurance here for sleep apnea oral appliances. And I see the physicians kind of encroaching into a little bit of our space because they're like, what's going on? These guys they're not getting it. So now
This
we
is
have
too much for them.
salivary diagnostic, right?
Yeah.
So we're kind of like blending. So I say let's own this space and let's
Yeah.
maintain ownership of this space.
Mhm.
And the way that we're going to do that is, first of all, the medical and dental industry, I think are just way too fragmented. They really should be under one umbrella. We are oral physicians,
Mhm.
and so that's the way we should act. But not taking into account the patient's genomics. I mean, like we don't look at the genetic predispositions of our patients to periodontal disease.
Mhm.
should be looking at that. I don't place any implants, nor does my office place any more implants unless we look at genetic predispositions through salivary diagnostics. I mean, we can see patients who are genetically predisposed to higher rates of inflammation. So is it my bad that did I place the implant wrong, or was it a bone issue? Or was it that the patient was just at a higher risk because they're genetically predisposed to some of these issues?
Yep.
So,
Yep.
that's something to look at. So
Mm-hmm.
how many dentists
Makes
out
sense.
there checking the genetic predispositions of their patients, right? Very few.
Mm-hmm.
How many of the dentists are out there looking on an annual basis at the oral microbiome to see what's going on? How has your age, your lifestyle habits, and your environment impacted your oral microbiome, and
Mm-hmm.
how is that potentially
Yep.
affecting those implants in your mouth,
Mm-hmm.
right?
Mm-hmm. Mm-hmm.
So it and what we've suffered as a profession is we've taken on this responsibility of dealing with um, failure and taking ownership of this failure that sometimes really is not ours to own. Sometimes these failures are occurring outside of our control, and so this is actually good for us,
Uh-huh.
right?
Uh-huh. Mm-hmm.
What are your thoughts about that?
No,
I
no.
mean,
So summarizing what you just said, I completely agree with your add-on, your correction here. So what basically what we are saying is that you have dentists, you have physicians, and now we are talking about the oral physician. Nobody owns it yet. Nobody owns it yet. The medical world is finding that out, and the dental world is finding that out. I would say that dentists have the first right of refusal because we are there and we are more present there more times a year because of those factors that we have the patient in front of us. So we have a little advantage that if we don't take that advantage, we're going to lose the space. So somebody will take care of this gray zone. Somebody will take care of this no one's land, I would say, that is the oral physician job to make the connection and start becoming a master on all the topics that you mentioned, because the fact is that even people like you and others that I see are deep diving on this, we cannot even consider ourselves masters at this point. We are just learning, right? We are just starting to learn about these amazing connections and possibilities. So it's really a space where in 5, 10 years, we're going to see, who are the ones that will take advantage of it. And I don't like take advantage, it's going to be negative, but who is going to take ownership of it to help their patients on all these factors that we mentioned here, right? And I can see physicians jumping in and I can see dentists jumping in. But for me, if you read Peter Attia's book, Medicine 3.0, a new generation of dentists will come and will become the Dentistry 3.0. And these are the
Yeah.
guys that will master this process.
Can I piggyback on that? Because I think both of what you're both saying is brilliant. So let me ask you a question, but it's going to be kind of like 3 parts of it. If I'm listening to this, why is dentistry such an amazing investment for outsiders? If I'm a dentist right now, the future of dentistry, I believe, is super exciting. And I want you both to comment on this. Right now, the global dental services market is valued at $393 billion. It's projected to be $415 billion by 2024, and then it's also projected to be $863 billion. I did say billion by 2032. Okay, think about that. 2032, it's going to go from 393 billion to 863 billion. Let me throw one more thing at you. One of the biggest challenges is the aging population. Right now, the proportion of people aged 65 and older is projected to double by 2050, which means we're going to have a lot of people. Right now in Japan, adult diapers outsell baby diapers. Okay, so I want you to think about this. This is an incredible time
Yeah.
to be a dentist and to invest in dentistry. True or false?
100% true. And I
Why?
actually think I actually think those numbers are bigger. I'll just give you one example.
Okay.
Let's talk about sleep apnea, right? So sleep apnea right now is, I think it's somewhere between 16 to $20 billion industry. And guess where all those patients are pushed? Traditionally, it's just been CPAPs. The compliance rate with CPAPs is somewhere about maybe 20 to 30%. So you got about 70 to 70% maybe of these patients who have sleep apnea but don't want to wear a CPAP. Guess what the next best alternative is? It's oral appliances, right? It's us providing mandibular advancement devices to these people. And so if you just look at the market cap of just sleep apnea, oral appliances alone, you're talking, 80 to
Mhm.
100 million dollars just in that space alone. So and then now looking at some of the fundamental things that are going on with like water fluoridation here. Let's just imagine how the billions of dollars that have been invested in just putting fluoride in water. And now we know, I mean, there's technologies today to help remineralize teeth. We have several of them.
Mhm.
So what's going to happen here, in my opinion, is that there's going to be a fundamental shift in access. You're going to have a different shift to access dental advice, dental products and services. Teledentistry is going to be one of those fundamental changes that I think that's going to shape, really
Uh,
rock dentistry.
uh,
So,
one comment on the on teledentistry. As soon as you go to proactive care instead of reactive care,
exactly, there
the
you go.
in-person becomes a little less important, and the virtual becomes much more relevant because by virtual consultation and virtual access and virtual care, you can address these issues in a proactive way, right?
There's no one else probably in the world better than yourself. I think you have the world record, right? From what I understand, in like generations of dentistry. Like you've seen the evolution of dentistry, as have I, growing up in a dental office, right? With my father's office. We've seen over and over and over and over and over again this discussion about prevention.
Mhm.
And honestly, like, really, have we done much over the last 30 years in prevention? I'm not sure we have. The rate of
No.
cavities and periodontal disease is, I mean, as prevalent as it's always been. True prevention is not going to happen in the medical office or in the dental office. It's going to happen at home.
Yeah.
So we have a choice here. We have a fundamental decision to make. Will we be play this protectionism and demand that everything happens in person because that's how traditionally it's been done and that's how we monetize it? Or will we as a profession expand beyond the brick and mortar and go reach our patients where they're
Hmm.
located? I
Hmm.
think that's going to be the case
Hmm.
because if we don't as a profession, the companies will just go direct to consumers and do it around us. They'll circumvent us.
Hmm.
So
Hmm.
the way I look
Hmm.
at teledentistry is that, and the reason why I founded Dentulu and the reason why, I do what I do with Dentulu is that we want to protect a standard of care that we can be happy about, but at the same time be able to utilize the innovations and technologies that are available to us to better serve our patients. Like,
Hmm.
do you really like sitting there and cutting class two, fillings? Is that enjoyable for anybody to sit there and drill teeth? I don't know. To me, it's not. I think this shift in dentistry can really move towards
Hmm.
minimally invasive
Hmm.
treatments.
Hmm.
Uh, with a massive impact, with a significant ROI, and patients can actually love dentistry because we
Hmm.
don't have
Hmm.
to sit there and do
Yeah,
mechanical removal of things anymore.
I did a post recently that kind of went viral and people went crazy discussing it. I mentioned who should be more awarded, the dentist who places the implant or the one that avoids the need of it, right? Uh, and of course, there will always be place for reactive interventionist procedures, like in medicine as well. You know, sometimes you need to intervene, sometimes you need to cut, sometimes you need to go in. But that should be the ultimate consequence, right? So reactive care will always exist, But the main goal of the profession should be to grow the proactive focus on prevention and longevity. That should be the majority of dentistry that we learn in school, that we learn after school. The huge majority of dental practices should be focused on that. And the exception, at the same way that in medicine, most places, most doctors should be taking care of prevention, and you will have the heart surgeon, or you will have the experts on amputation and prosthesis on diabetic patients that cannot reverse the process. You will always have space for that, but it's obvious that we need to focus on how to prevent that, right? So I think that in dentistry, the shift will happen when our mindset will change, on not bragging about the number of implants that you placed last year, not bragging about the number of veneers that you did last year, but bragging about how many patients that you have that needed nothing from you besides guidance and prevention.
I mean, you want to talk about bragging. Brag about how much money you made without having to do as much as you had to do the prior year.
Exactly.
Owning and operating a bunch of dental offices, made me learn about, okay, who's your target audience, what areas, location. Yeah, like, are you only going to market to the people in a 5 mile radius or 10 mile radius? I mean, now think about you as a clinician can now potentially treat people in a 100 mile radius.
Yeah.
So you're talking about income potential and impact potential.
Mm-hmm.
Now I treat patients currently in a 200 mile radius, right?
Mm-hmm.
And we're not talking about just triaging here. So let's talk about the elephant in the room when we talk about this. It's the companies like Smile Direct Club.
Mm-hmm.
Did that feel good to any clinician? I know it didn't make me feel good because I that's partly why I even got into this. I was like, I don't like to feel like, people are doing ortho at home. But I saw that there was such a massive demand, and
Mm-hmm.
I said, there's something there. So maybe I don't feel that it's the standard of care personally, and this is my personal opinion,
Yeah.
that is the standard of care to do orthodontics at home without direct supervision, right? But I have zero problem sending you a saliva kit to your home and
Mm-hmm.
checking your saliva and being able to
100%.
engage you in that, right?
Uh-huh.
No
Uh-huh.
problem whatsoever
Yeah.
at all, right?
100%.
I also don't have any problem doing a remineralization tray for someone at home.
Mm-hmm.
I have no problem saying take an impression at home and I'll make you a tray that you can put in MI paste. Put in your own toothpaste for God's sakes. Like that, just increase that contact time with your teeth and let's help remineralize some of these teeth. Let's put in some perio gels and help improve the periodontal health. So there are certain things that I think can safely and effectively be done remotely. And I
100%.
think those things are the preventive, the minimally
Yeah.
invasive stuff.
Mm-hmm.
And
Mm-hmm.
as we see more and more products come out to the market that
Mm-hmm.
help with remineralization, with
Yeah.
improving oral microbiome, we find
Mm-hmm.
that those things can safely be done
Yeah.
at home. And what we also see that is that when you engage patients in that manner, you
Mm-hmm.
get more visits to the dental office. These
Mm-hmm.
will
Mm-hmm.
actually drive more patients to the brick and mortar, and we can actually see more patients because we've engaged them now in a safe
Mm-hmm.
environment. One stat that I learned,
Uh-huh.
one thing, anxiety and fear is one of the primary reasons people don't go to the dental office.
Yeah.
Their anxiety triples or quadruples just sitting in the waiting room.
Yeah.
Not even doing any dentistry, they're just sitting in the waiting room. So just imagine the shift in environment, like if you can talk to someone in their home, how that safe, comfortable environment now allows you an opportunity to actually engage the patient and
Mm-hmm.
hopefully be able to educate and get them to come into the dental office.
Now you hit the nail. You hit the one of the crucial points for the shift. That is the business model. And I always mention this, that yes, we like to believe that we are ethical health providers, and I do believe that the huge majority of dentists are trying their best and are behaving in the most ethical way. But at the end of the day, everybody wants to make money. And we know that you can make some changes in the way you do dentistry because of ethical reasons, but it's usually easier for us to make changes when there's a financial push to the change as well, right? So,
Agreed.
unfortunately, dentistry has been rewarding whoever does more reactive, whoever intervenes more. If you prep more, if you place more implants, if you destroy more teeth, if you extract more teeth, you get more money. You are more rewarded, and you can even brag more about what you're doing because of the numbers, right? So for me, I always believed the big shift, not the visionaries, the early adopters that usually move besides anything, but mainstream will happen when we can define a new business model that makes general dentists make more money with dentistry 3.0. That general dentists can make more money with prevention, can make more money with longevity, can make more money postponing the tooth death cycle, postponing the tooth death cycle, and you make more money. And for that, we need people like you that are reinventing the wheel, that are actually succeeding by doing that. We need people like you telling the story of how you did it, how you shift your practices into that direction, and you're not less profitable, you are more profitable because of that, right? So your business model is the key for the transformation, because as soon as people learn that, they will be much more prompt to make that change as well.
I saw this quote by Elon Musk. Um, it was I think simplicity is just so beautiful, right? And it's so difficult sometimes.
Yeah.
We tend to overcomplicate everything. Um, very simply, he said, they were asking him what are your rules in investment? And he said, if you use that product, if you like it, invest in it. If you
If it,
see that you don't like that product, it's not doing anything good for you, don't invest in it. So
Mhm.
if it's something you like, probably others will like, and it probably has a higher chance of being successful. So when it comes to dentistry, right? We've never, or at least myself, I never thought about, I really like this, I don't know, implant line. And it works really well. Maybe I should invest in Nobel, or maybe I should invest in Strawman, or whatever, Hyosin, right? Um, or Megagen, right? But now we know that through various organizations that have been set up, and there's several different funds in dentistry, that dentists, they need us. They really, really need us, not only to help provide feedback, provide advice, our experience, but also to help educate our other clinicians and promote the products. So, I mean, the cost of marketing some of these things is very high. And so if you already have a bunch of dentists who are not only invested in the company, they're more likely to use the product, they're more likely to promote it and utilize it. These companies would love to have clinicians, and you don't have to be famous.
Mhm.
You
Mhm.
don't have to be a famous speaker or a KOL. You just need to be you,
Yeah.
and you need to provide your not only your advice and feedback. Sometimes it's just a matter of just providing some time, and you don't have to invest large sums of money. Sometimes it's 10,000, 20,000, and if you really believe in a company, you can continue to invest in that company. So one of the amazing things that's happening in dentistry is that innovation is occurring faster and faster. Whether it's because of increased computer capacity or artificial intelligence, the innovation curve is just going like this. And so more and more innovations are going to come at a faster rate. And these companies are going to rely more and more on us to be able to provide active feedback and to also be able to be the early adopters and funders. And
Mm-hmm.
so the opportunity here is multifold.
Mm-hmm.
Not only can we help promote good products and help accelerate their adoption, but we can also be one of the first people to use this in our offices and wow our patients. I mean,
Mm-hmm.
the things that I do in my office, I don't know anyone else that's doing it, um, you know, in
Mm-hmm.
my area.
Yeah.
I start my patients off with something like this. I think I showed this to you, where I just put this over their teeth, and I'll see if it shows. I'm not sure if it'll show, but
Yeah.
you see this?
Yeah.
So this will show all the plaque, and I just show this to them. I have an intraoral camera version, so they see all the plaque and biofilm light up. And they're like, "Oh my God, what is that?" It's like it's all showing red. So this is like a digital disclosing tablet, right?
Mm-hmm.
So I show that to them, and then the next thing I do, I'm like, "Well, look, let's take a look. I don't know. This could be anything. It could be good biofilm, bad biofilm. I take a little sample and I put it under a microscope, and I have a microscope in my office, and the microscope then is displayed on a large television screen. And what do they see? All these things moving around, and they see all the little bugs, and they're like, "Oh my God, what is that? What are those things moving around in my saliva?" I'm like, "Well, I don't know. Let's go test it." So then I go into a saliva test, and
Mm-hmm.
I take the saliva test, I send it off, and I get an actual lab report.
Mm-hmm.
And so now the lab report comes back, and I go over the specific bacteria that they have and the levels of those bacteria.
Mm-hmm.
Now we've gone through this like completely different workflow. And by the way, yes, I take x-rays.
Mm-hmm.
But except my x-rays are backed by artificial intelligence. So
Mm-hmm.
now I have AI also looking at my x-rays. So what am I doing here? I'm now I'm now using neutral third-party validation,
Mm-hmm.
which completely eliminates this mistrust
Mm-hmm.
that sometimes they have. They're seeing it, they're believing it, and I'm just validating the findings. And
Mm-hmm.
now we have a patient who is very motivated and convinced,
Mm-hmm.
and no one has ever done this. And then I tell them, here's an intraoral camera. I do a little evaluation,
Mm-hmm.
and I think I've shown this to you. Is
Yes, this is amazing.
I use the mouth cam, and this is a personal intraoral camera. The mouth cam, and you can get one of these. They're under $100. Talk about talk about patient retention and patient acquisition. You know, when I started off dentistry, the single best thing I ever did that helped increase revenue was show people. I used to take an intraoral camera and show them the plaque, and I used to have TVs, and I still do in front of every op, and I just show them what's going on, and I would go one by one and do my treatment plan by showing them. Now they can actually take this home, and they can engage not only themselves, they can be a little bit more accountable as to what's going on, but they can check their kids' mouths, they can check their husband's mouth. And if there's a problem, they can immediately be connected to me through photos, through videos, and through live consultations. So these are very simple things. None of these things were expensive. Saliva test is like $100, $200. This thing is, $100. The intraoral camera is less than $100, but now I have increased patient retention. I promote patient acquisition and referrals, and I've
Mm-hmm.
completely wowed my patients because nobody's doing this down the
No,
street.
this is out of the world. This world, and it's just the beginning. And you know, since we are getting to the end here, and I just have a few more minutes with you guys. I don't know, Kirk, if you have a final comment, but I want Arash to close it up and give his final message and reason for people to join us in Miami.
I have so many questions, but we should save those for a future episode. I want people to take some action as a result of listening to this. I want them to find out what's going to go on in Miami.
Well, I think that there's a huge revolution and evolution that is happening in dentistry. I think that this is one of the biggest opportunities in our profession to prove our value, to own the oral health space, and to happily make tons of money doing the right thing, helping our patients, improving the quality of our life of our patients, and honestly ourselves, by practicing a more minimally invasive type of dentistry, a more comfortable and higher revenue type of practice, we will live better lives. Our staff will be happier and our patients will be happier. And there's nothing wrong with making money. I hope to have the pleasure of sharing some of the tools that I've learned about amongst some of the esteemed colleagues that are going to be there and talking about this. And then talking about opportunities even outside of dentistry, where we can invest in some of these innovative companies that are coming and helping accelerate them to market. And I think that ultimately dentistry is going to be the front line. Out of all the medical and professions, I think dentistry is going to be the front line to overall health. And this is the biggest orifice in the body. This is where, you know, the majority of food, bacteria, pathogens enter the body, and this is our opportunity to really help reshape dentistry, and being the doctors we know and we claim that we are. So it's exciting, it's fun, and hopefully very lucrative for the audience as well.
Fantastic. I think that's a great summary. And Arash, you are from now on definitely my investment advisor and my new tech in dental advisor. And I'm gonna love to pick your brain live on stage in Miami. And of course, there we're gonna have also the slides. You're gonna be able to show the images and share the workflows, and also interact with people during the breaks. You know, and you know, just because of that, I think joining us in Miami is already worth it. Besides everything else that is going to be going on with John Kois and his team and all the digital dentistry that is going to be shared there as well. This topic is really what is exciting me the most, and it's going to be amazing to share the stage with you. It's going to be fun. Thank you very much for your time.
Yeah, it's my pleasure.
Awesome. Very nice to meet you, Arash.
Likewise. Thank
Great
you.
stuff.
See you in
Christian,
Miami.
yes.
I hope you can join us, Kirk, in Miami as well.
I plan on it. So Christian, you want to close us out here?
One more very exciting episode. As you can see, my excitement on this topic is just growing and growing, and I'm impressed that with the fact that as I open my brain to these topics more and more, I'm meeting people that are deep diving into them. So as soon as you create this space in your brain, synchronicity will just start to kick in, and you're going to meet the right people, you're going to meet the right opportunities, and you're going to start to bring these benefits to your patients. We stay in touch. And see you guys.
Everybody. Have a wonderful day.
Have a good day, everybody. Bye-bye.